Let's talk about something that's a huge source of frustration for so many people: chronic low back pain. But we're not just going to rehash the usual suspects like slipped discs or muscle strain. No, we're going deeper. We're going to investigate a really complex and, honestly, an often overlooked source of pain that might just be the missing piece of the puzzle.
I mean, think about it. Maybe this sounds familiar. You've tried everything, gone to every specialist, and you're still searching for relief. But what if the whole time the problem wasn't your lumbar spine at all? What if the real culprit is hiding right where your spine plugs into your pelvis?
Well, say hello to the sacroiliac joint, or SIJ for short. It's this incredibly important part of our anatomy, but it almost never gets the spotlight in the conversation about back pain. Today, we're changing that. We're putting this joint right under the microscope.
Okay, so to really get why this joint can cause so much grief, we've got to understand what it actually does. The best way to think about the SI joint is like the keystone in an arch. It's that central wedge-shaped stone at the very top that holds the entire structure together and handles all the weight.
And you can see it right here. Its location is absolutely critical. That C-shaped connection sits right at your body's center of gravity. It's literally the bridge that transfers every ounce of weight and every movement from your upper body down into your legs.
And wow, look at this. This really shows you just how strong this joint is. It's not just bone meeting bone. It's reinforced by this incredibly dense, powerful web of ligaments. They basically strap the joint together, creating this super stable platform. In the world of biomechanics, they call that force closure.
But here's the really cool part. It's not totally locked down. The SI joint actually allows for just a few degrees of tiny, subtle movement. And that little bit of give is essential. It lets the joint act like a shock absorber for your entire body, soaking up all the twisting and impact forces from walking, running, you name it. Okay, so this all sounds straightforward, right? Big, important joint, absorbs shock. So why is it such a nightmare to diagnose when things go wrong? Well, as we're about to see, figuring out if the SI joint is the problem is some serious medical detective work.
And this is the real kicker. Pain from the SI joint is a master of disguise. It doesn't have a unique fingerprint. It can feel almost identical to a herniated disc, a problem with your facet joints, or even a hip injury. Because of that overlap, doctors have to be incredibly careful and rule everything else out first.
So, how do they zero in on it? They use this series of special physical exams called provocative maneuvers. The whole idea is simple: to kind of poke the bear, gently. They carefully stress the joint in different ways to see if they can reproduce that specific pain the patient always feels. Let's take a quick look.
First up, you've got the Osgood test. With the hip bent, the examiner pushes down along the thigh bone, which sends that force directly into the SI joint.
Next is the Faber test. It's an acronym that stands for flexion, abduction, and external rotation. You might know it as the figure 4 position. It gently pries the joint to see if that triggers the pain.
Then there's the compression test. For this one, the patient lies on their side and the examiner carefully squeezes the big hip bones together, which, you guessed it, compresses the SI joint.
Gansland's test is all about creating a twisting force. By pulling one knee to the chest while the other leg hangs off the table, it puts a very specific rotational stress right on the joint.
And finally, the long ligament test. This one's pretty straightforward. The doctor applies direct pressure with their thumb right over the ligaments at the top of the joint to see if that specific spot is tender.
Now this is absolutely crucial. A single positive test doesn't mean much. To really be confident and avoid a false alarm, the clinical standard says at least 3 of these 5 tests have to come back positive. That's when a doctor can say, okay, we have a strong suspicion here.
But even with 3 positive tests, that's still just a strong suspicion. To really nail it down, to get the final confirmation, they use what's called a diagnostic injection. Using an X-ray or CT scan to guide them, a doctor injects a numbing agent, a local anesthetic, right into the joint. And if the pain just disappears, bingo, you found your source.
All right, so you've got the diagnosis. Now what? Well, the journey to relief is where things get really interesting. The treatment options range all the way from conservative care to surgery, and the research on what works and what doesn't tells a pretty clear story.
So the typical first steps are things like physical therapy or wearing a special belt, but the medical literature is pretty blunt about this. Studies have found no clear evidence of usefulness. Then you have steroid injections, and sure, they can help for a little while, but the effect is not long-lasting, and patients often need multiple shots just to get temporary relief.
So you can see the problem, right? If the standard stuff often doesn't cut it, What's left for people who are in constant, debilitating pain? Well, that brings us to a really game-changing surgical option, minimally invasive fusion.
And you can see exactly how it works right here. It's pretty incredible. Through a tiny incision, we're talking just 3 to 5 centimeters, a surgeon can place a few small titanium implants across the joint. And the result? Look at that scan on the right. Those triangular implants lock the two bones together, getting rid of that painful micromotion and creating permanent stability.
And the results? I mean, they really speak for themselves. Get this. Studies are reporting a patient satisfaction rate of around 90%. 90%. For people who have suffered with this for years, that is just absolutely life-changing. So, when you boil it all down, the benefits are super clear. You've got a very high rate of serious pain relief, a response that actually lasts, and some studies even show it's cheaper in the long run than getting endless non-surgical treatments. And it's all done with a minimally invasive approach.
And hey, don't just take my word for it. The medical community is really getting behind this. This quote from a big 2020 review pretty much says it all. Because of the high rate of pain relief and duration response, this surgery should be considered.
So that really leaves us with this one big question. For the millions of people out there dealing with that mysterious, frustrating back pain that nobody can quite figure out, could this hidden joint, this keystone of the body, hold the key they've been searching for all along? Thanks for joining me.